Hi, everybody. Thank you so much for having us today. It's so wonderful to see all of you online. So, today we are going to talk to you about the versatility and benefit of key language. So, our hope for today is that you will have a better understanding of key speech and key American English. And we would like to be a contact and a resource to you as we are part of the National Key Speech Association. So I am a native Kiowa, which means that I grew up with Key Speech. I went to St. Andrews University in Lawrenceburg, North Carolina, and now I have a job with Bayada Home Health Care and the rehabilitation manager for our intellectual and developmental disability service line. And I am also a co-rep for Spring Camp Cheerio.
Sorry. Hi, I'm yes,
And
so
again, with Camp Cheerio, just the early 90s, more to come on that. Kitty deck.
okay. Sorry. Um, I am Kitri Kylo, and warm hello to you from cold Minnesota. We have 3 inches of snow on the ground, and our temperature is a lot lower than out east where you are, most of you are. Um, I am retired at this point, but very active still I was a regional deaf and hard of hearing regional program administrator in Minnesota. And my background is in deaf and hard of hearing. I worked in that field for 40 years. I What's unique about the program I ran is that we implemented and I um, supervised an ASL and Acute American English bilingual access deaf and hard of hearing program for over 25 years. And currently I'm the Upper Plains regional representative for the National Acute Speech Association, and I'm the acting organizational liaison also. Um, Let me know if you are not seeing the bottom of these slides. If Jennifer can let me know, because my pictures or my gallery view is at the bottom there. Anyway, so we will go on here.
Going to share a little bit of my personal story. I was diagnosed with profoundly deaf at 13 months old because there was no infant screening back then, so my parents didn't know. And they started me on Keen American English at 18 months old. And I grew up on Keen American English and AB therapy. And I was mainstream all through school and college. And I had SRP services on the side, as well as I got my first cochlear implant in 1994, and I am about to get my second one in a couple weeks.
And I'm going to clarify that for people that don't know what a CLT is, that's a cued language transliterator, which is there is one that is providing cued language services during this presentation.
Oh, and in the picture at the bottom of the last screen, that is my family at Spring Camp Cheerio in the very late 1980s. So this is one of my favorite slides. I'm going to talk about Spring Camp Cheerio. This is a camp in the North Carolina mountain that is open to all forms of communication, include American English, American Sign Language, and spoken language. We offer scholarship for first-time families and professionals that want to come learn Key speech, as well as we have a children's program, adult program, acute language translator program, and we also have speaker and adult session. But we also could have fun as well. While the period during class, the children get to play, they get to go hiking, canoeing, have all kinds of fun. And on the next slide, we don't have time. I'm not gonna play the video, but hopefully I can email with the link, and it's a YouTube video, and it shows you what spring camp cheering is all about.
So I'm not going to cover every point of this particular slide. In essence, I was in the field, as I mentioned, 40 years, but I had been a dorm house parent and an assistant at the Minnesota Residential School for the Deaf. And then I became a teacher. Before becoming a teacher, I was a certified sign language interpreter, and then became a teacher, and then later a supervisor and coordinator, and then an assistant director of special ed for about 33 years, 27 of those in the southeast metro of the Minneapolis-St. Paul area. And I supervised more areas than just deaf and hard of hearing, but that was my background. I did write a chapter that's in a textbook from 2010 that is labeled, that is called A Bilingual ASL and Cued American English Program for Deaf and Hard of Hearing Students, Theory to Practice. And that's, as mentioned, it's in a textbook called Cued Speech and Cued Language for Deaf and Hard of Hearing Children. All right. What was unique about our program, and I alluded that in the previous slide, is that in addition to you having children have access to the language of instruction of American Sign Language by staff who were adult fluent users, deaf themselves. They were the language models. We also supported kids who had implants and had hearing aids and had use of the benefit of developing listening and spoken language skills. We conveyed English through spoken and cued American English. So that was a very unusual component of a bilingual access program that isn't found in too many places in the United States. So one thing we want to touch on right from the beginning is the different terminology surrounding the system of cued speech. Cued speech has been in existence for almost 60 years, but it's not very well understood yet. Because of further understanding over this almost 60 years and research, it has evolved to current terminology. So when you use the system of cued speech, it's called cued language. When it's used in the United States, it's called cued American English. When you're cueing versus signing. So cueing is the mode. And we talked about it's a cued language transliterator. It's not a cued speech interpreter. But there is a wonderful article that's called Understanding Cueing that was published in the summer issue of the Hands and Voices Communicator newspaper. So that is an excellent resource to help understand the different terminology. I just want to quickly refer to 2017 snapshot survey that was put on by the National Center for Hearing Assessment and Management, which is called NCHAM, for those of you who are familiar with that agency. But it was a survey of parents of deaf and hard of hearing children who age 2 to 6. And they asked families different questions, but what came out pretty clearly was there is a need for families to receive accurate and quality information about cued language. The statistics that they gathered showed that as compared to other modes of communication, those that reported fair to poor were in listening spoken language was 24%, ASL 34%, total communication 36%, but 57% of the parents said that they had received fair or poor information about cued language at the time of the diagnosis of their child. So we are here to try to provide information to you, whether you're a parent or you are a provider. Some people have not really seen cued American English in action, so I just want to show really quickly, not the whole clip, but this is one of the speech language pathologists that I used to work with that is cueing with one of her preschool students.
Wow. The trains all look different. Thomas looks worried. Percy looks happy. He's laughing. And Gordon looks angry.
His home was
Okay.
a nice icy land.
Okay, I'm going to go on. Whoops. Okay. So some of you that are familiar with the legal aspect of special ed law have often heard the term least restrictive environment, LRE, in which they say that learners have the right to be taught in the least restrictive environment. For learners who are deaf and hard of hearing, we have to consider what is the least restrictive language or communication environment. And for children who are deaf or hard of hearing that have poor or absent access to auditory information, that access needs to be clear, it needs to be complete, and it needs to be visual. So, and that means access down to the language of the conversation and instruction around them at what we say is the fundamental phonemic level, down to the very foundational level of language. And we'll be talking more about that, what that means. So there's a lot of skeptics out there. And so we like to address the elephant in the room right away. People who say, well, why do you need visual systems at all? Why can't you just use manually coded signed English? Or why not visual phonics? Or why not use ASL first and then have children learn English second, later? What evidence supports using cue speech? We won't have time to go into all of these, but we're going to try to address some of these questions with you.
I am going to cover the first question. Why use a visual system at all? I wanted to show you this picture real quick. So this is a third grade teacher speaking in the third grade classroom. You can see the pointer piece is missing. So imagine I'm in third grade and I'm in class, the teacher's walking around the room, the kids are talking behind the teacher's back, kids are tapping on the dash, you know. If I didn't have a Q-Neighbors translator at the time, I would have missed all the puzzle pieces. So I thought it was just a good visual way to show you how often I miss things. In this slide, we're talking about good examples of why I need Q-Speech. For example, in the situations where it's at a noisy restaurant and I'm struggling to understand what's going on, or if I'm doing an activity such as whitewater rafting, or if I'm riding roller coaster out of truck wearing my cochlear implant, I use Q-Speech in those situations. And then other situations, you know, hearing aid not fitting, if you have ear infection, I mean, I could go on and on. I'm showing you all the examples of why I would need Q-Speech. Q-Speech was developed by Dr. Oren Cornett in the 1960s. This is a picture of me with Dr. Cornett in the 90s, with my curly hair and everything. So he was a vice president of long-range planning at Gallaudet, and that's where Q-Speech was invented. And his goal was to increase literacy rate for deaf or hard of hearing children. With Dr. Cornett, he said what was needed was a convenient way to represent the spoken language accurately, the revision in real time. What is Q-Speech and what is Q-Neighbors? So the definition of Q-Speech is this is a visual manual system that allows the deaf person asset to the phoneme of spoken language through key language in real-time communication. You may think this sounds very similar to visual body, but the difference is visual bodies cannot be used in real-time conversation. And also key language is a mode of communication and it is recognized under ADA idea. All right, what is key speech? There are 3 components. There are 8 handshapes and 4 locations that represent the vowel phoneme. So it is a very finite system. So it's like typing what you learn, you got it.
Right. And the 8 hand shapes, I'm not sure if you covered, the 8 hand shapes represent the consonant phonemes, which are phonemes are the same thing as sounds. And as you said, 4 locations, the 4 locations, and Courtney will show you some of those in a minute here.
Now a keys made. So keys are the handshapes and placement combined with cluster vowel pair. I'm going to show you a quick example for phoneme that sounds similar. A key with different handshapes. For example, mat with the M, mat. Or pat with a P, pat. Or B with bat. And then there are also phonemes that are different of the mouth, but they have the same handshake. So ban, bean, bone, bun. So it's the same handshake, but my mouth placement looks different.
So I'm covering these next few slides, and we have a little demonstration of which we ask you to participate. And what's hard for me at where I am is I don't see any of your faces. I'm just looking at my gallery view includes Courtney and myself and the interpreter and the transliterator. So I don't know if you are going to, I won't be able to see if you were able to participate, but I'm going to ask for Jennifer's help to have you help me with your responses. So this next little tiny demo, it'll be brief. It's to simulate the experience of deaf and hard of hearing children trying to lip read when they have no or are experiencing greatly diminished hearing. So I want you to watch what I say, jotting down your guesses for just 3 items I'm going to give you. Normally we do this with a list of 5 to 7 words, but due to the short, the limited time we have, we're just going to use 3 examples. So I'm going to have you watch me and then write down what I said. Again, this is to simulate a very auditory compromised environment, as many deaf and hard of hearing children experience. So this is number 1. I'll do it again. Number 2. And number 3. Okay, so the big question is, what did I say? So I'm going to give you the answer since I can't see you, but the first one was pop. The next one was mom. And the third one was Bob. And I'm just wondering in the chat, did anybody get any of them correct? Did anybody respond, Jennifer?
No.
Okay, well, obviously it's making the point that there's so many sounds, phonemes or sounds that are not intelligible on the lips, which it makes very, very difficult for children who have compromised hearings or no hearing to acquire language through that way. So I'm going to do a really quick mini crash course in teaching you 3 hand shapes that represent 3 different consonants and 1 vowel placement. So I'm going to, for those words that we did, if you can copy it at your end, and again, I don't see you, but this is for p, p. So p, this is p, p, and this is b. If you know signing, this is the way I first learned it. It helped me remember that this is the finger spelled word for B, but this is with the hand the other facing the other way. It's b, b. So p, b, and then with the thumb out is So in the and then the other the 1 vowel placement I will teach you is ah. So ah, not aw, but ah, as at least that's how we say it in Minnesota for pop, mom, and Bob. Do it with me again. Pop, mom, and then Bob. So now I'm going to give you a little test, and I'm going to give you 3 words just through cueing. So use what you just learned. All right. Number 1 is I'll do it again. Okay. Number 2 is and number 3 is all right. So I'm going to give does anybody want to see him again? If you can let me know, Jennifer.
All right. So we have someone saying to please do that again.
Okay. All right. I'll do them again. And so number 1 is number 2 is and number 3 is all right. And I'm kind of doing it in the wrong, usually it's a little bit lower, but in my little screen, I wanted to make sure that my hand was visible. So now I'm going to show you the answers, and then just let me know if you were able to catch any of those. Number 1 was Bob. Number 2 was palm, as in the palm of your hand, or pom-pom. And number 3 was mob. So again, I can't see anybody raising their hands. Did anybody get all 3 of them correct? You can answer in the chat.
All right. We have 1 person who got them correct.
Did anybody get 2 of them correct? Or 1? Okay. Well, bravo to the one who got them all correct. And I don't know if any of you got any of them, but the point is, and I don't know if the person who got them all correct has learned any of the cues before, but the point is most of the time when I do this demonstration, people do get them, or most of them. And the point is, let's think about it for a minute. So if you as an adult are able to quickly catch on and learn this finite system, even a part of it that quickly, and you can learn the different phonemes or the sounds, visual correlates for sounds through vision, just through vision alone, isn't the same true for children? And that's exactly what happens. Kids pick it up, cued language, as naturally as hearing kids pick up spoken language through immersion and exposure. So, all right, we're going to move on.
on this slide because I say that I hear with my eye. So typically, traditional spoken language is accessed through the ears. But true speech by true language can be accessed through the eye at the fundamental phonemic level. So I'm going to cover our next question. Why has the true language via the system of true speech be used more widely? Why is it not more popular? So the system of true speech appeals to all for the mannerless, or to manner for the oralness, and the name true speech makes it sound like the goal of speech. But that's not always true. The goal is visual asset to the fundamental phonemic level of language. Could you please be free to add to this?
Right. I just want to add that this bears a lot more conversation that we don't have time for now. But I also think that a big aspect is that the system is not people that go through the deaf and hard of hearing training programs or speech language pathologist programs are not introduced or exposed to what this is. I think there's a lot of misunderstandings surrounding the system of cued speech and that it conveys language. So we're trying to hit on some of those misunderstandings. I know that I didn't get it, it wasn't taught in my teacher, the deaf and hard of hearing program. And whatever I heard about cued speech was never a positive thing. It was a negative thing. So, but it made amazing difference with the students that we had. So I'll talk about that just briefly. I tried it in our presentations. I try to give some examples of the results that we saw with our students. Because there's limited time, I do want to say that our students did much better than the national average, achieving at least a full year gain in reading on national standardized tests of reading compared to the national average. But one of the things I say, though, is people don't realize that before you come to the task of reading, you have to have language skills. Our children who are hearing have already had many years of internalizing the oral vocabulary, the structure. They have phonological awareness, phonemic awareness before they're expected to come to the task of the reading. So these are all the skills that you have to gain as a competent reader, and I would say a competent writer. But what skills do you have to have before you even come to the door to be exposed to learning phonics, to how to decode sounds? Well, you have to have all these skills first. And that's what a lot of our deaf and hard of hearing kids are lacking when they come to the task of learning how to read and how to decode. I'm just going to quickly show you some writing samples. These are spontaneous writing samples. And this was a learner that came into our program at 4th grade. So he was displaying, he had been in a total communication program prior to that. The parents had moved across the metro area to be for their child to be able to attend our program because they realized that he was greatly delayed in his language skills and in reading. So as a 4th grader, this is what his spontaneous written language looked like. And you can tell it was very deficient in terms of syntax, of vocabulary. The wolf fell off, big pail down, down, down he goes. He tumbling, ow, he said. He is dead, Towel said. He's straighting, he spelled it wrong, but this is we leave all the errors that a student does in, but then by year 2, oops, usually I put year 2 and year 3, but I just wanted to show you year 4, after immersion in English through an accessible means, meaning Cued American English. And he also had access to ASL in our program by native deaf ASL users. this is what his writing was like. His syntax is greater, his vocabulary is greater, he has much more depth in his language. A boy named Rudy climbed the mountains in Switzerland. He was climbing on the glaciers when he saw a black dot on the mountain. It appeared to be a hut, and he decided to stop there to sleep several times. So you can tell that, you can see the growth. And that is, this kind of writing is what he should have been already having when he first entered 4th grade, and shouldn't have had to be delayed, but he did come up and catch up in terms of his reading and writing language. They became on par with his peers who had normal hearing. So that was exciting. So we look at what is the linguistic signal. We know that input drives output. You have to have language coming in for it to be able to come out in your writing or your spoken language. And so we have to look at what systems or modes provide a clear, complete, unambiguous access or to the linguistic signal in the target language. So I'm talking about these different systems. If the English target sentence is, I am going to the store, then in the system Signing Exact English, it has some of the consonant vowel phonemes, but it is missing all the ones that you see here with the blank lines. It has I and it has am, but doesn't have go, doesn't have to, doesn't have in the, and there's nothing available in the sign for store. And the same is true for Pidgin Sign English. It's absent all the consonant vowel phonemes of English. If you look at ASL, it has none of the consonant vowels of English, and it shouldn't, because it's a different language. Its phonemes are completely different than consonant vowels. Its phonemes are movement, placement, orientation. And so you can't convey French through English. You can't convey English through French. And the same is true. You can't convey English through American Sign Language, and you can't convey American Sign Language through English. So if you look at the system of cute speech, or cute speech using the system of cute speech, cute English, I mean, it has all the consonant vowels that hearing people have access to through auditory means. So I am going to the store. So we didn't talk about how consonant vowels are often at the same placement. The hand shape is they're paired with, consonant vowels are paired often in the same place. So I am going to the store. So that gives a comparison of what is missing from other visual systems.
I am going to explain what cute language is. So cute speech is the system. In American school, we use cute American English. So cute speech has been adopted to close to 70 languages and dialects. For example, cute Spanish, which we teach at school cafeteria, cute French. And there are other countries as well, Iran, Germany, Poland, it's all over.
And so
So this is the chart that Kitty was talking about earlier that has the 8 handshakes. 1, 2, 3. I'm not gonna go through them all, and then the 4 placements of the mouth. And you have the cute chart and you practice, you could become fluent. For example, I only see my cute speech friend, maybe 4 to 5 times a year. And if I have a cute month, I can pick it right back up without missing a beat. So how long does it take to learn cute speech? It's about 15 to 20 hours in a classroom. So you could go to a cute camp or a workshop, and you could take a beginner class, or you could do it online. And there is a link, I believe, at the very bottom of this slide called Q College, It is online sub-page. It is free to parents. Kira is a great way to learn how to express the language that you already know. So a question, is Key speech a language? It is not a language, it is used the system of Key speech, which is a mode of communication. Kitri, can you add to this slide, please?
Yeah, I think here lies the confusion around terminology. The finite system of 8 hand shapes, 4 placements for vowels, the 8 hand shapes for consonants, 4 placements for vowels. That is the cued speech system. When you use that system to convey the language of English, it's cued American English. But if you're cued, because there's cued Spanish, there's cued French, there's cued Polish, that's cued language, just like there's sign languages, different sign languages all over the world. And in the United States, it's American Sign Language. So English is a language. Cueing is the mode of communicating that language, just like the other modes of speaking the language, writing the language, and cueing. So there's spoken English, written English, and cued English, all conveying languages through different modes. In the same way, ASL is a language. Signing is the mode of communicating that language.
And I'm going to give a quick example of how parents say, oh, you're bilingual. And then, no, that's not how it works. Kiwi is just the mode of communication for spoken English. So I wanted to show you the chart real quick. And you can see all the spoken languages, English, Spanish, and French, all have a written, spoken, and cue component. However, ASL and BSL only have the sign portion.
I'm just going to quickly address this question. Why not use visual phonics? There's nothing wrong with visual phonics, but it is a system to help kids learn how, help them with their spoken language articulation and so forth. So cued speech and visual phonics are similar, that they both use hands and face to give a viewer visual information associated with a phoneme, associated with the sound, but they're different. As Courtney mentioned earlier, that visual phonics, it's intended for explicit phonics instruction, but it cannot be used in real time in language interaction. And cued speech conveys, the system of cued speech conveys language at all levels in natural real-time language interaction, which is how children and we, as even if adults, if you learn another language, you have to learn it in the context of natural, intensive immersion. And this is a graphic that shows that same concept. This is just a quick example, visual example, that in cued speech, using the system of cued speech, this is moo. But in visual phonics, there are 6 different steps that are used to convey the same word. So 6 different movements is not efficient to be using in real-time conversation. So
Real quick, I am just going to recap everything we covered today. So phonemic awareness, access to spoken language of the home. I'll give an example. My parents did not know sign language, so they wanted to give me the language of the home, which was spoken English. And I'm not going to keep going, but these are all the examples we covered today.
Yeah, multiple benefits of using cued language. So, and I just want to say, we saw it all the time in our program of kids exposed to English through an accessible system of cued American English. They would acquire language and internal language, but expressive language through writing on the same level as their peers who are deaf and hard of hearing. So that's the goal of helping our students achieve their full academic potential.
Kitty, can you do this one?
Yeah, we've kind of covered this in already, that, what's important is that this system of cue speech to cue language allows for early access to the language of the home. So in a lot of homes, there's an expectation out there that all parents should learn American Sign Language first. Sometimes there's an expectation on the part of some people. There's nothing wrong with learning American Sign Language, but you're not going to be a fluent user of American Sign Language and a fluent language modeler to your child. So for that period of time, that language learning period of birth to 3 to 5, those are critical language learning years, and they're important years for neural development in general. So it's critical that, if parents can cue the language of the home and they can convey their culture and that's critical. And then whether a child learns ASL later and through exposure to other adults who are fluent users of ASL, or if they don't learn ASL and they, what we found is that cueing also can accelerate listening and spoken language skills. So,
I'm going to talk about two neighbors, a cochlear implant. For example, I have a cochlear implant, and I believe they go hand in hand together. I had AP therapy growing up as a child, and the AP therapist told my mother that I did not need cue speech, and my mother stood up for both of us, and she said, "We are doing both," and we did both. I want to give an example. I'm getting a new cochlear implant because my battery life is terrible. I only get about 6 hours now. So sometimes I forget to bring batteries with me because 6 hours goes by pretty quick. So sometimes I have my husband use cue speech with me whenever my implant dies. So they go well together.
yeah. And the important thing is cued language can provide that phonological foundation before implementation, and while a child is learning to use their cochlear implant, they shouldn't be missing language while they're during those times. So, and once they are learning how to use their cochlear implant, it gives them confidence for attaching the new sounds they are hearing to the phoneme that they know is there, that they have acquired through cued language. So
I'm going to talk about cue speech and initially a spoken language. So I grew up with a cue language translator all through school, and sometimes there's mixed conceptions that I may be always dependent on a cue language translator, but that's not always the case because sometimes we use it less and less later in life. We learn language proficiency and confidence. So it is not a crutch, if that makes sense. Do you have anything else to add to that?
well, it's that children are continually learning language throughout their school years, in the early childhood years, but also throughout school. And there's, huge amount of vocabulary they're being exposed to in school, and there can often be confusion. So cue can help fill in sounds that they miss in a noisy environment in the school, in the school environment, or they can clarify new vocabulary or names, new names to the child. So it's a wonderful insurance policy, so to speak. We want our kids to acquire complete language without any holes. So I'll talk very briefly that Cued American English can pair well with American Sign Language in a bilingual program. I have years of experience with that. Cued American English and ASL are both unique in different languages. They use different modalities. By using a Cued American English to access English, ASL is left intact. If you're using Total Communication or SimCom, that leaves out the grammatical features from both the languages. So their kids are not getting a good model of ASL, they're not getting a good model of English. Both of those different language and modalities provide 100% visual access to 2 different languages. And Cute American English allows English to be acquired naturally and simultaneously with kids that are exposed to American Sign Language. So the important thing is that it provides verbatim access. Cute American English or Cute Language allows verbatim access to the language of the school, the language of the curriculum, language of standardized tests, and it's important for future higher education and job opportunities. I think because we are really close to the end of time, if you are receiving the handout for this presentation, there are a number of resources that very quickly, the National Acute Speech Association, and the link is there at the top. It has lots of resources. I recommend that you go to the website. Something to be aware of is that parents can receive a free kit called the DCLP, or Deaf Children's Literacy Project, a free kit of that you would you receive 4 free boxes during the course of a year, one a quarter of information and a fun toy and activity for your child, but different language building ideas. And plus there's, besides NCSA, free membership for a year for new parents. There's free access to the online Cute American English course. There's other resources. Q College is a plethora of resources for the free course I just mentioned. For other Cute Speech virtual classes, you can get tutoring from a Q tutor, and there's a lot of materials in the Q store. Some examples of that are kits, seasonal kits to be using with kids and families learning how to Q. And there's Q with me in the winter, Q with me in the fall, Q with me in the spring, Q with me in the summer. And those that sign up for a free parent kit that I just mentioned can get one of these 4 kits for free and the other 3 at half price. There's a very colorful Cues of American English poster. And then there's other resources. I don't know, I don't want to go into them in depth. Is that okay, Courtney? We just mentioned that if you're interested to go to these resources. But do you want to mention the ones in North Carolina and South Carolina?
So Language Matters is a language transliterator company in North Carolina. The CARE Project, the director of Massachusetts, Laura Pike, she is a mother of a child who is deaf, and she allowed me to post her phone number and email if you're a mom and you want to talk to another Cuspy's mother. And the very last one, Stephanie, she is a national certified Cuspy's instructor in North Carolina, and she is available for Q classes. And so they're wonderful resources. Take advantage of them. So we have about 10 minutes left, so we're going to open it up to questions. I think Jennifer was going to maybe open it up and you could use your cameras.
Yeah, at this time, I'm going to promote our attendees to panelists, and that will just allow you to rejoin as a panelist, and you can turn on your video if you would like to, or you can just keep your video off and ask questions in the chat or with the Q&A function, but that'll just take me a couple seconds.